1970 when I finished my studies.
What did you study?
I did my medical degree at Grant Medical College in Mumbai.
Okay.
And then I came after my internship to work in Uganda,
Right.
where I worked in Masaka to start with, Masaka, a small hospital, and then moved on to Kampala at the Makerere University, which used to be called the Mulago Hospital. Mulago Hospital, which was a teaching, I think it was the first teaching medical school in East Africa, if I recall it well. I got a chance to work with Professor Sedikari, a pediatric consultant, was a Ugandan consultant, and Professor Stanfield, who was from Newcastle. Because my professor said that leave the country. There's no future in here.
Is this your university professor?
Yes. And he said, just go to Newcastle, just leave, and then I'll make sure there's a place for you. I left that night. Her husband actually helped me out.
Were your parents still in the country when you left?
They were still there. And my father would not leave because he said he would be the last guy to leave. And he said to me, because I just refused to leave, but he said, they cannot take your knowledge, they can steal your money. I think, looking back, very true. And if you're alive, you can do a lot of things. And I actually went back to my room, didn't have my food that night.
Okay.
A good cry, I remember. Come morning, somebody knocked and said, look, you are entitled to £4 or something per week, or £3.
Okay.
And I said, look, I did not know the system in here, so I said, I don't want any charity, but I got still £15. But I want to go to Newcastle. Can you just direct me how to go there?
Okay.
And they actually helped me. I phoned the hospital, and there was a professor, I forget his name now, lovely man, and he actually said, look, Thakrur, I'll be expecting you.
Yeah.
You can come, and we'll come and receive you. And I recall he had given me £200 as a gift.
Very generous.
A huge amount of money. And my reaction was that I don't have the money, I'll accept it with the promise that I'll pay you back. That's it. Which comes from the family values. My parents. And he said, Dr. Thakrur, we'll sort it out later on. When do you want to start? I said, I can start tomorrow. He said, no, have a rest for a day or two. And I started there in earnest as a pediatric registrar. It's very cold, much colder than London. And the people were quite nice, but I had a problem understanding the Geordies. It was difficult to really understand the language. But I just carried on, and after about a week or so, I think I got settled down. But I think I was not trusted as a doctor by my senior registrar, who was an Irish doctor.
How do you mean?
I wasn't given any clinical work, except that I was, when the patient came in, I wrote the notes, ordered investigations. I was not allowed to take any blood, so do anything at all. Until Professor Stanfield came from Uganda. He met me, he said, Navin, how are you doing? And I said, look, I'm doing fine, but Prof, I'm not very happy here. So what's happening? I said, look, I just cannot, I'm just more or less a clerk, rather than a physician. After a few minutes, he said, look, Navin, we'll sort things out, don't worry. Give me some time. I've just arrived. And incidentally, what happened after about a few days, a doctor arrived early in the morning, suspect of meningitis.
Okay.
So I called my senior registrar, because it's the doctor's son. I think you better call the consultant. And they called the consultant, and Professor Stanfield came in, and he said, examined. He said, yes, it may be meningitis. I want you to do a lumbar puncture, the same way we did in Uganda. No anesthetic. And I was out of practice for about 3-4 weeks, and I said to Professor, look, give it a try. And he called the child, and fortunately everything went on smoothly. When we sat down over a cup of coffee, he casually asked me, he said, Navin, how many lumbar punches have you done in Uganda in the last 6 months? I said, maybe 300 or over. And I could see my senior registrar jumped out of his chair. He said, we have not even done 30. I think that was a good friendship. And that's how things started working out. There was a lot of trust.